So thank you very much for joining us again for this important evening session. We are continuing with our dispensing lecture series, and tonight we are going to look into package inserts and patient information leaflets as part of your portfolio of evidence development. So just to say welcome to this important session. We are going to cover the requirements of completing the course. We always cover it just to make sure that we are all on the same page. Then I will also discuss with you how to approach your portfolio of evidence. Today we are focusing specifically on the package inserts and patient information leaflets. We are then, hopefully, if we get time, towards the end, you can then also provide us with feedback, general feedback about the course and your experience so far. For those who are joining us for the first time, please note that Ms. Mamosakekana is the course coordinator, and then I'm your official instructor. And note the email address. This is the main way to communicate with us. We are improving our turnaround times for replying to your requests. And I think in the next few days, you should start to experience where we at least reply to you, within 24 hours in terms of all your concerns. So use this email irrespective of the issue you might have at any given time, whether you want to find out about your POE, you want to submit it, you have a question about the course, or whatever other challenges you might be experiencing. We recommend that you specifically use this email for all official communication, right? So just remember, in terms of completing the course, there are certain requirements that you must meet. And number one is that you need to read, right? Remember, at the end, you are going to have to go through the summative assessment, which is a difficult multiple choice question. And if you pass that stage, you would then also be required to do your final open book practical exam. We are trying to review how to best do this practical exam because remember, COVID caught us by storm. So we need to look at if we can change that also, because we have managed to translate the summative assessment into a digital platform. Now we want to look into the issue of the open book practical exam. You have to read. So reading is not an option. You have to read, right? We have to read. All of us, we have to read. So that's very important. And then you have to read the resource guide. So you need to, if you are going through the course, you must have the resource guide. That is very important. This is where it's like your manual for the course. So you have to go through the resource guide if you want to understand, clearly what is happening and how to handle this work, right? And then remember, once you are reading, you're going through your e-learning, then you have to submit your portfolio of evidence, right, which must be submitted as part of your affidavit also. So your portfolio of evidence, it is a specific assignments that you have to complete. We are doing this with you on a week-by-week basis, and my hope generally is that you do your best to complete, Sorry about that. I had muted everything by mistake. So yes, so just to say that, remember to do, you know, your portfolio of evidence on a week-by-week basis. So that is very important. And then please note at this point here that it is a recommendation from myself and everyone that you must keep your records. You must always keep your POE, your records, even after submitting. You know, don't delegate that task to me or to Aqua. It's your responsibility to keep your portfolio of evidence. Whenever it's required, you need to be able to submit it. Once we are happy with your POE, you will then be given access to do your summative assessment. And if you pass it, you then do your final examination. So please remember all those things, right? So just to say that there are requirements for completing the course, right? To qualify for the certificate of competence. Remember, when you pass, we will give you a competency certificate, right? And then we have to say that you are competent. Number one, you must pass you know, your portfolio of evidence you have to submit. And this portfolio of evidence is covered in what we call the learner assessment guide, right? So I said there's a resource guide, which is your manual. Then there's the learner assessment guide, which then is actually your portfolio of evidence, except that when we give it to you, it is empty. Now, your responsibility is to go through that learner assessment guide and ensure that you then populate your evidence. You do your prescriptions, you do your labels, you do your calculations, and today you go through your information inserts and so on. So that is number one. And then number two is your assessment there, assessment, which is a multiple choice question. And then number three is your final practical exam. And we do these things in sequence, right? You do your portfolio of evidence, you do your summative assessment. If you pass, then we book you for your open book practical exam. And once you have done that, then we have the confidence that you know, you are ready to be certified, competent, and we can defend your clinical practice even in public. So that is quite important. So today, our focus for today, just to still add to the point, is that we are focusing on the package inserts and the information leaflets. So that is our key focus area. We are looking at how do you approach your portfolio of evidence in terms of your package inserts and your patient information leaflet. In your learner assessment guide, right? You see, these are two guides. So you need to be able to differentiate a resource guide from a learner assessment guide. So a resource guide, that is your training manual, and then your learner assessment guide, specifically, it's where you do your portfolio of evidence. So this learner assessment guide, it is equals to POE, right? But it becomes a POE after you have done your 8 times learning activities. Don't forget, learning activities, right? And you'll see today we are doing learning activity number 5, and it's on page 32 of your learner assessment guide, and then also page 33 in terms of now the knowledge. Before you do the POE, you have to read. So you start by reading, right? You read first, right? You read first. That is important. Once you have read, then you do your POE. Just remember the process. Don't start with a POE before you read, because you will fail that, and also you won't be ready for your summative assessment at the end, right? So I hope that we are together on this one. So just to then show you what am I talking about. So remember, you've got 2 documents. If you look at this particular one, this is what we call a This is what we call a resource guide, right? I'm hoping this is your manual. So if you are new, ask the coordinator. If you don't have this document there, ask the coordinator or send us an email on support@aquatraining.com. You must have the manual, which is a resource guide. Then also, what we have is what we call a learner assessment guide. Now, the learner assessment guide would generally include your POE. So this is your POE, right? When we say submit your POE, we mean submit this document. You would have completed all the sections for your 8 learning activities inside there. You would have completed all of them. And then you would include all attachments that are necessary because maybe there's not enough space in the document for you to complete all sections. Then in addition to that, you then also submit your affidavit. And even this affidavit that I'm referring to, it is included as part of the guide, right? So this is your learner assessment guide. You can see we have included information that talks to how to develop your portfolio of evidence, and then make sure that you print it, you take it for a stamp. In terms of your affidavit, you must sign it, you must get a witness, and then you stamp it at the post office or the police station to confirm that this is your work that you are submitting. And you can see your portfolio of evidence, right, should respond to the 8 learning activities, right? That is very important. And what are these learning activities? The first one, evaluation of prescriptions, which we have already done. And then those of you who are new, don't worry, you'll get the link today to today's video. When you go through that link, you'll find other recorded sessions on the evaluating prescriptions, dispensing labels, prescription records, dispensing calculations, which we did last week. And then today we are dealing with your patient information leaflet or package insert. That's learning activity number 5. So this is very, 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 very important, right? So what I want you to focus on is that, remember, there's people who don't pass or who don't even complete, right? You'll see that if you, remember here at Aqua, we give you 3 months to complete the course. We support you for 3 months, but if you fail to complete in 3 months, you have a maximum of 6 months to complete. And if you don't complete in 6 months, you need to re-register. That will cost you an admin fee of 500 rands. So that is, just the administration fee besides the registration costs. So please try to complete on time. And then also note this statement here, right? Note this statement here. If you do not pass, like I've heard that the current group, people didn't pass the summative assessment. So it means if you want to redo the assessment, there's an administration fee that you would need to pay for that. So please note that, and then make sure that you don't, firstly, you need to make sure that you don't fail. That is the first part of passing, is to ensure that you don't fail, so that you don't waste money and waste your time. These things are very, very, very important, right? So remember, today's learning activity is on page, who remembers? What page is that? Page 32, right? There we are. So today we are dealing with learning activity number 5. Let me see if I can make it big for you. I hope that is a bit better. Yes, that is a bit better. So today we are dealing with learning activity number 5. And it's about what we call a patient information leaflet, or for the professionals, that's what we call a package insert in other terms, right? So let's look at it. So number 1, you must be able, for you to pass this specific learning activity, you must be able to distinguish between a package insert and a patient information leaflet. That is the first thing. You need to understand how to draw one a patient information leaflet with correct headings, you know, using the right word. And you need to be able to distinguish information regarding medicine which is relevant, you know, for a patient versus, and this is important, right? We want to differentiate patient information versus information that is directed at health professionals, you know. So what is the difference between the two, and which tool is best suited to do that? So it's very important that you know that a patient information leaflet, right? A patient information leaflet is designed for adherence, right? For patients, right? And for the purpose of this learning activity, there is a patient information leaflet which is provided, and it is in one language. But remember, the legal requirement that it must at least be in 2 languages. These are the things you will get during your summative assessment, you know, and then that your patient information leaflet, right, is written for a patient, not for a health worker. It must be patient friendly, and it should be aimed at a reader who at least has a grade 10 or standard 8. So the language that you use, don't use very professional, you know, language or information such that at the end of the day, you know, we fail to meet, you know, what we were trying to achieve, right? So you have been provided with a patient information leaflet plus also a package insert for beclomethasone, so the inhaler for asthmatic patients most of the time. So, and then in terms of the learning activity, you have to give reasons which of the 2 documents, right, between a patient information leaflet and between a patient information leaflet and a package insert, which of these 2 reasons a document is best suited to promote adherence. And you have to give your details there. But make sure that you have the depth in terms of this topic, because at the end of the day, you're going to write the final exam, and there will be a lot of questions about this particular topic. So when we say a patient information leaflet, we mean a document like this one. What you can see is that it's got instructions. It is very clear. I mean, it's giving patients, you know, steps on how to use the inhaler, and the language is very simple. Before using the inhaler for the first time, you know, it's very simple. It's not meant, the information here, healthcare workers can read it, but the language that is used, it's used for a high school student, and it's very basic. And I think the use of drawings is very important, so that even people who cannot grasp the language, they can actually understand, you know, what is happening, and the use of colors, you know, but you still have technical information, you know, about this leaflet. For example, here on the side, you still have, you know, technical information about the drug, the schedule. This is a schedule 2 drug, you know, and what is the active ingredient and the dose. So you can see this one, you'll get the dosages, you know, and also the provider details, you know, are included, you know, and so on. So that is quite important for us to note. Then we have remember this one is a PIL, patient information leaflet. Then we have a package insert, and obviously when you start looking at the package insert, you can see the font is very small. It includes very technical, you know, information. For example, you know, things that maybe patients should not necessarily be paying attention to, but this is now information that is directed, you know, to a health worker specifically. So it's very important that when you do this exercise, you really pay attention to the differences between a patient information leaflet versus a package insert. If you are able to do that, you will do well, right? So let me see if then I can minimize the document. Yes. So let's then go now. Okay, yeah, I think it's the same document. So now I'm opening our resource guide, right? This is our resource guide. And now we need the content knowledge. So what is the theory? Before you even go and attempt to do this exercise, you need to have a theory. So remember, we said the first page is page 33, where you find information about, and there it starts, section 1.4.8. It tells you now about the laws, right? So you can see there, it says package inserts and patient information leaflets. And then now the medicines, and really you have to read the act. If you want to pass, please, my dear sisters, this is an act that you need to familiarize yourself with, the Medicines and Related Substances Act, and then Regulation 9. Regulation 9 of the Act is the one that deals with package inserts and specifically. So it says, information contained in the package insert of the medicine is specified in the Act, and the following list and categories of information must be included, right, when you design a package insert. So the schedule, to say Schedule 1 or Schedule 2, you know, the name of the drug, contraindications, pregnancy, whether the drug is safe and how it can be used during pregnancy and breastfeeding, the dosage, side effects, you know, storage instructions, and then the name and business address of the holder and when this package insert was actually written. So that is very important. Ne? And then in terms of complementary medicines, bolengana and all those vitamins, herbal things that we are currently using, there has to be a statement identifying the discipline of the medicine. If the medicine has not received registration with the council, remember now in South Africa, this is something else for you to note, we no longer have this MCC, right? The name has changed. It's called SAFRA, right? So you note this because you might get a question in the exam to show that you are current in your understanding. So SAFRA is now what we used to call MCC, the company or the regulator that regulates medicines, but also that approves drugs, and all the drugs that we use in South Africa are registered with SAFRA, right? So then now a patient information leaflet. Remember now, a package insert, which we are addressing there, is targeted at healthcare workers in terms of the information. Now we are referring to a package, a patient information leaflet. So each package of medicine must include a patient information leaflet. And this leaflet must contain the following information regarding the medicines. Number one, it must be in English. Always English must be there. And then at least one other official language in the country, because we are targeting, you know, our patients. So the scheduling status, to say what is the status of the drug, the name and dose, the composition of the medicine, the approved indications, instructions before taking the medicines, which should include contraindications, when to use the drug and when not to use the drug, right? And it should include statements like always tell, you know, your health worker, always tell your health worker if you are taking any medicine. So these are requirements that these sentences must be there. They should also be advised about how to take the medicine if they are pregnant or during breastfeeding, the importance of not sharing the medicines, And to say if you take an overdose by mistake, you know, how then do you deal with it? And then again, a note about side effects. We have to include that. How to store, you know, the medicines, like store all medicines out of reach of children. You must remember, if your package insert does, I mean, your patient information leaflet doesn't have this information, if an error happens at home, it can be a malpractice claim against you, right? So that is very important. So presentation, how, in terms of presentation, it means what is the drug? Is this an inhaler or is this a tablet, and how many milligrams, you know, and how the tablet looks like, the registration number of the medicine, the name and business address, telephone number of the holder of the certificate of registration, so the owner of the medicine. So that's very important. And again, in case of complementary medicines, our herbs and stuff, we must identify the discipline, and then there must be a note to say this medication is not approved or has not been evaluated by the Medicines Control Council. You know, this includes your aloe veras and your forever products that you include, right? And then section 1.8.3 is very important. So you need to know the difference between an information leaflet and a package insert. So firstly, patient information leaflet is meant for the patient. This information is important for correct use of medicines, because when people don't have enough information, the medicines can be used wrongly. They can also cause harm, yeah, to patients. And remember, the language must be that of a high school learner, actually secondary school more than anything. And the main purpose of a patient information leaflet is to empower patients. So you are trying to give them information so that they can take responsibility. We encourage self-care, right? We want them to be adherent, so that's very important. We want them to be adherent. We want them to be responsible, right? And we want them to be able to recognize if there might be problems, and then also to improve communication between patients and healthcare providers. So that is very, very, very important, right? So now a package insert. Remember, now we're talking about a patient information leaflet. Now a package insert is designed to give a health provider information about the medication. And unlike a patient information leaflet, medical, and we use the big terms, right, for people who can understand a very deep English, you know, and the package insert information may be used by prescribers, so pharmacists and so on, and the dispensers also use the information to ensure the ingredients which are composed in the medication may not cause harm, right, to our patients. The package insert also provides information which may be used for patient counseling, specifically linking it to adherence. So that is very, very important to understand, right? So you'll have to go to page 33 and read up to page 36. And then once you have done that, you then go to page 186, you know. Yes, so let me see if I have not missed. What is this? Yes, so there, you know, we start with page 185. So it talks about providing instructions to patients. So how do you provide that? So it starts by saying that when a medicine is applied to a patient, right, we need to provide counseling. We need to make sure that patients have adequate information, you know, about the drug. And preferably, we want to make sure that this information is simple and is provided through what we call a patient information leaflet, right? And the type of information must be structured, right, to meet the needs of individual patients. And it should, at a minimum, have information about the safety of the drugs, how to correctly use it, and how best to use it, so that our patients, are safe from medicine errors. Ne? So it must have the name and the physical description of the medicine, the intended use and action, the route how to take it, and when to take it, and the precautions around the medicines. Drug to say don't take this drug, with something like a flagell. And you will see next week we are going to do your drug interactions and patient education to avoid adverse events is quite crucial, and important. So that is very good, and where to store it, and so on. So again, this is a repeat of the earlier section, but maybe with emphasis, on other key things, just to say that a patient information leaflet is very important for promoting patient adherence and the law. So it's a law, right? You don't violate the law. You shouldn't be giving patient medicines without instructions on how to take the medicine. When things go wrong, then you get into trouble, right? And whatever leaflet you use, it must be in 2 languages. I think we have addressed that, and it must include some of this information, as we had discussed. And then the general statements around that some medicines you might not take them together, that's very important. If you are pregnant, contact your doctor. Do not share your medicines. If you take more than you should, contact your doctor. And then another important side effect, another important point is this one here, that not all side effects are reported, on a package insert or patient information leaflet, right? So if they feel unwell, they should contact the doctor. And then how to store the medicines must also be covered as part of that, right? Yeah. So that's now what I've just taken you through is from the resource guide, which is the manual. Now you have the theory about what is a package insert. What is the difference between a package insert and a patient information leaflet? What are the components of a package insert versus the component of a patient information leaflet, and which one is targeting patients, which one is targeting healthcare workers. So that is very important, and then therefore, once you have read this, you go to your learner assessment guide, right, which is learning activity number 5, and then you do a task. Now the task, which was previously probably looking a bit difficult, now is going to look a bit easy, right? Why would it look easy? Because, well, number one, they say you have been provided a package insert and a patient information leaflet for beclomethasone inhaler, and you know that if patients who are asthmatic don't know how to take their inhaler, that's where we get a lot of recurrence, right? But you can, to evaluate this activity, you may use even any, like a nasal spray for people with asthma or those with sinuses. It's the same thing. So if you want to learn more, right? Then you have to answer this question. In your opinion, so it's your opinion, but your opinion must be based on the theory that you have just read on page 33, page 185 to page until 186. You need to explain which of these two, so it's a competition, right? Which of these two would promote patient adherence, and you must give 5 reasons for that. So yeah, so ladies and gentlemen, I really look forward to your submission on this specific question this week. And then remember to keep all your records and make sure that you submit your portfolio of evidence. timely. And then thank you very much also for taking time in your evenings, to join us for these sessions.